to confess, people have been complaining as we go around the country, well, you're speaking to the choir, and we've always said, oh, well, even choirs need choir practice, so you can go out and entertain other choirs. That's the deal. Thank you for coming out on this beginning to be threatening day. We just had a meeting with John McDonough up in Congresswoman Comstock's office. He was brought in from the Washington, D.C. office, so we feel like, they're bringing in reinforcements. The bus has arrived. And to talk a little bit about our experience inside while a couple of our other people catch up, Sister Rochelle Friedman, one of our sisters on the bus, is going to share a little bit about what happened.
Thank you, Simone. I know some feedback that we got is that a number of you, perhaps some of you, have tried to get a meeting with the representative and or her staff, and have been pretty unsuccessful in doing so, but thanks to Stephanie and Simone, we did get this meeting. So clearly, the Stephanie over here, yes. The message was conveyed to the office that constituents really want a little bit more face time with staff and the representative. John, whom, as Simone mentioned, is in the Hill office of Representative Comstock, and he does health care and taxes. And so we tried to make a couple points about the correlation between taxes and health care. She, by the way, voted yes on the tax bill. And now the Republican leadership is saying, oh my goodness, now we have to start cutting entitlements because, the tax, well, they don't say the tax bill, they talk about the deficit, which is going up, which, as you said, yes, they caused. After some pressing, I think Angie, where's Angie?
Right here.
Okay, Angie talked about, she has a little lobbyist, her little daughter, she's going to report. But I think that I sort of heard that maybe they would promise to try and get meetings for some of them. So there have been a few promises, maybe. One of the things I think to note is two things I guess I'll say before I turn it over. One of the things that I think is so damaging to our democracy is the putting down of the media and putting down sometimes of very reputable sources of information. So sometimes the meeting felt a little bit back and forth. And the Congressional Budget Office is one of the places that I know those of us that work on the Hill say this is good information. The Congressional Budget Office reported within the last 2 weeks that revenue from the 2017 tax season was down $160 billion on the corporate side because of the tax cuts. And so John's comment was, well, sometimes data isn't accurate. One other thing we heard, and there was some good pushback from people at the meeting on that. One of your constituents did a very good job of that. And that is, we often hear this, you hear, okay, Ryan and McConnell want to do this, that, and the other thing. And from working up on the Hill, there's deafening silence. They don't get pushback from their members. So we really said, we need Representative Comstock to push back a little bit. And what we were told by John is, oh, well, but she's not on the finance committee that does entitlements. She's not on the finance committee that does taxes. She's not on the ag committee that does the farm bill, which she voted for, which dramatically cut SNAP. We cannot let them get by with that excuse. Amen.
Amen. I didn't mean amen. I agree. All right. Well, you can tell it was a little little hot in the meeting at times. Finally, I was sitting next to John. I just put my hand on his arm and said, well, I think we can find some ways to agree, and showed him our principles. We have 10 things that we at Network object to in the tax bill. Rather than going into each one, I said they were sort of like the 10 commandments for what should be fixed. And hopefully he'll read it. We'll see. Now, I want to invite Angie up to share a little bit about her daughter, because I think her story with the little lobbyist is really powerful, important, and all of the reasons why we the people have to make sure families are protected. Angie.
You guys have to forgive me. I have a little bit of a cold. I promise not to cough in the mic too much. Good afternoon. My name is Angie. I'm sorry. Is that better? My name is Angie. I was invited to share my story here on behalf of the little lobbyists by the Nuns on the bus tour. I'm here to talk about my Princess Anna. We are a very private family, but have allowed others into our lives in an effort to save the health care that Anna needs to survive. Anna is medically fragile. She was born at 25 weeks along with her twin brother. She has struggled from the moment she was born. Anna has a tracheostomy, a feeding tube, tracheobronchial malacia, cerebral palsy, metabolic bone disease, and quite a few other diagnoses. I became Anna's mother at 2 months old, when she was 2 months old. We were told from the beginning not to expect Anna to be able to come home from the hospital. I looked at her and said, I'll love you every day of your life. I was told several times that Anna would be in a vegetative state. I was told she would never walk, she would never talk, and that her quality of life would be compromised. I still said, I will love her every day of her life, no matter what. By 6 months old, Anna had a surgery to put her trach in her feeding tube in. By 7 months old, Anna had her first of many cardiac events. By a year old, she had lived almost her entire life in a hospital environment. At 2 years old, I officially became her mother. Officially taking on the responsibility, I was told that the Affordable Care Act and Medicaid, should never be a worry of ours. I believe what I was told at that time. In 2015, Anna became very sick. Due to my husband being in the military, Anna and I were flown to the D.C. area. We were brought here because the hospital we were at in Arkansas had ran out of resources for her. Since moving, Anna has started to defy the odds. She started walking and talking. She's also started school where she is ahead of her class at this time. This is not a special needs class, this is a class. She is able to attend school due to having access to a home health nurse. This nurse is provided by the Medicaid waiver program. Without this program, Anna would be homebound. Her accomplishments are purely based on herself, the therapy and medical providers she has. Currently, Anna receives care in multiple hospitals. We're seen at Walter Reed in Bethesda, Maryland, and Cincinnati Children's Hospital in Ohio. We currently are due to go to Ohio Monday for a series of surgeries to hopefully remove her tracheostomy. We will be there for 4 to 8 weeks. Healthcare should never be a partisan issue. We have to protect the most vulnerable human beings of our society. Provisions in the currently suggested legislature would exclude protections for pre-existing conditions. We cannot do this. Anna is amazing and she is moving mountains. Please don't let her down.
No. The little lobbyists are the biggest powerhouses in D.C., and now we know why. Because of their valiant, tremendous, engaging stories and their powerful parents. Let's give Angie another hand. Woo-hoo. Thank you. And now Jim Bomer from an SEIU member who was also in the meeting is going to share a little bit about what his story is and why it matters to him. Jim.
Thank you. Thanks a lot. Well, we're here to get out the vote, and we need for everybody to vote because I'm here for my niece. She's got cerebral palsy, a pre-existing condition that Barbara Comstock voted to gut, and we cannot stand that. The last Virginia governor wanted to eliminate home care programs, which is the program I work for my niece that she needs to live. And if she doesn't have that, her dad can't work, and the family can't function.